was founded in 1954. The Komfo Anokye Teaching Hospital, also known as G, is the second largest hospital in Ghana and the only tertiary health institution in the Ashanti region. The hospital also takes referral from the northern, northeast, Savannah, Bono East, Bono, Ahafo, Central, Western North, and other regions. Years of being stretched to its limit with no corresponding redevelopment have left the hospital sick. The hospital that is sick and in dire need of surgery. The management, with support from the Asante, launched the Heal Komfo Anokye project to raise $10 million to rehabilitate some structures of the hospital. And this afternoon, I'm joined by the head of public relations with the hospital, Mr. Kwame Frimpong. Adepoju, you're welcome.
Thank you.
And of course, I also have the chairman of the Heal Komfo Anokye project, Sami Adubache. Sami, you're welcome.
Thank you very much, Elton.
And along the line, we'll be joined via Zoom by the CEO of the Komfo Anokye Teaching Hospital as we look at what really the issue is with Komfo Anokye and how best this project can help bring it to a level that can be described as international. So that is our discussion this afternoon. If you are in Kumasi, you've used Komfo Anokye before, or you are on admission at the Komfo Anokye Teaching Hospital or a worker, you can send in your comments, your questions as we look at helping Komfo Anokye get to that standard. So let me start with you, Mr. Adu. So Heal Komfo Anokye, it means the hospital is sick. A teaching hospital that is sick. How sick is the Komfo Anokye Teaching Hospital?
Thank you very much, Elton, and greetings to your cherished audiences across the world. Komfo Anokye is sick and needs healing. Let me describe it in this way that if today you have to go to the hospital to seek for treatment, and let's say you are admitted, let's say you went in with a foot injury or let's say surgery for your leg or something like that, you are likely to come back with malaria, which of course wasn't part of the reason why you went there.
You go to a hospital and come home with more sickness.
Yes, and it is not just because maybe, of course, of people may have a conception that maybe the hospital has not been much, let's say, not taken care of. The point is that the hospital is very stressed. As you rightly said, it's been the referral point for 12 out of the 16 regions of Ghana. So it means that there's a lot of pressure on the hospital. So for 70 years of its operations, the hospital has not seen any major facelift. So obviously, within the space of these number of years, there will be pressure on the hospital, and obviously things will not be as it used to be before.
So what you are watching is also the state of Komfo Anokye Hospital now. This is a teaching hospital, the second largest in the country, and look at the state of the hospital. And you tell me if this can be described as a hospital. I'm sure if you're looking at it for the first time, you will not come to the conclusion that this is a hospital. You will be describing it in other words. But this is the state of the second largest hospital in Ghana, Komfo Anokye Teaching Hospital. Let me bring in Mr. Kwame Frimpong, the Public Relations Officer. So why have we allowed Komfo Anokye to deteriorate to this level?
1954. It commenced formal operations in 1955. So the structure is 70 years this year. And by next year, the hospital will be 70 years since it started operating. This is a hospital that was built for less than 500 beds. We are now counting about 1,200. The same space, but the beds have increased. So the hospitals had a dual problem. Problem with age, because naturally, when you put up a structure for 70 years, if you even don't do anything at all to it, it will still deteriorate.
So in the last 70 years, there's not been any kind of rehabilitation?
There has never been any comprehensive renovation of the hospital, despite its constant use. I've told you about the numbers in terms of beds, the progression that we've recorded over the years. For 500, we are now heading around 1,200, 1,300. What has happened is that we've rather compressed the utilization of the space. So instead of an area where we would usually put a bed, we are now putting 2. If you're supposed to put 10 beds, we are now putting 20. And so because the hospital has not seen any expansion. So overutilization has also taken a very heavy toll. Ashanti region has been over the years one of the most populous regions. In fact, it was the leading or the most populous region in Ghana until the 2020 population census, when Greater Accra came at power. Now, Komfo Anokye has remained the only hospital all these years. all the programs that were intended to expand the infrastructure never succeeded. A typical example is the maternity children's block, 950 bed, for 47 years. We couldn't even finish it. Way back in 1976, they realized that the catchment area of the hospital was expanding and the clientele base was also growing, so there was a need to expand the facilities. Unfortunately, we never had that benefit. So the existing infrastructure, we've been compelled to use it for the same population that maybe twice the space that we are using now should have been used for. So it's just a question of space and then a question of age that has resulted in this current state of deterioration.
But Kwame, I'm more interested in why it's taking us 70 years to have this discussion. I mean, this is a public institution. Yes. So therefore, there's no budget from central government, there's no budget from the internally generated funds to sort of undertake periodic rehabilitation.
We've been doing the routine maintenance, but for a facility that is used intensively as this, you need a comprehensive renovation every now and then. That has never happened.
So there's some kind of government neglect, will you say?
As a matter of fact, Ashanti region generally has not benefited much from investment in the health sector until recently that we are seeing a number of hospitals coming up.
In the last 67 years of our independence?
Yes, because how come the most populous region in Ghana, we only have one tertiary facility? When the same population in Greater Accra or less until recently had multiples, people are spoiled for choice here. But in Ashanti region and beyond, Komfo Anokye has always been the only hospital that has been providing tertiary health care. So as a nation, we've not invested much in healthcare infrastructure generally, but Komfo Anokye is even worse off because apart from being the only hospital of its kind, without any support, it has been compelled to provide tertiary health care for the increasing number of people who are there without the requisite investment by the state. The first attempt that was made to get the hospital renovated, we are told, was somewhere in 1981, during Liman's administration. Subsequent to that, there has been a number of attempts, but none of them materialized. I've been with the hospital since 2005, and each administration and each government had made a certain attempt to try and undertake a comprehensive renovation of the facility, but none of them has seen the light.
It's never been. But the key issue is, despite the fact that you find yourself in a very peculiar environment where you are attending to other regions, apart from the Ashanti region, the facility is so stretched that, I mean, you are unable to live up to expectation. But my understanding has always been that Komfo Anokye was a referral, or is also a referral center. Yes. So therefore, some of the cases could go to South or the KNUST hospital. Are they not taking some of the load?
All right. So this is the problem of Ashanti region healthcare infrastructure generally. There are issues with numbers, there are issues with capacity, and there are issues with a range of services. The numbers, because the special hospitals in the region, as well the public ones, you take Komfo Anokye out, the rest are not that at par with the kind of care that people will require, which will prevent them from coming to Komfo Anokye. So ultimately, they all end up at Komfo Anokye. In terms of capacity, now look at Korle Bu. Korle Bu has almost 2,000 beds. Komfo Anokye has 1,200. Master South Hospital, which is acting, because we don't have a regional hospital.
As a regional hospital?
It's acting as a regional hospital. It has 140 beds.
140?
If you come to Accra, Rate has 400 beds. If you go to Tech Hospital has 100 beds. If you come to Accra...
And Tech is the KNUST hospital?
Yes. KNUST Hospital. If you come to Accra's counterpart, UGMC has almost 600 beds. So the disparity is so stark that no matter what, given the same population that we are catering for, no matter what, these ancillary hospitals that are supposed to Komfo Anokye, they do not have the capacity, and we don't even have their numbers that to take some of the burden in a significant way.
So is that the reason the hospital is in this poor state?
Yes, please. Because I've told about overutilization. How come a hospital that was designed for 500 or less is now taking care of 1,200 people for the same space? There hasn't been any significant inpatient facilities at the hospital since 1955. That's an emergency center which was completed in 2008. It's basically a transition facility for the resuscitation and stabilization of patients, and then they are moved to the wards. Unfortunately, the wards have remained the same. The space for the wards have remained the same. This is inspired by the fact that as we speak, if you go to the hospital now, people have traveled from all over Ghana to seek OPD specialist care. The average is 1,000 a day. So every day that hospital is visited by this number of people. Out of this,
1,000 people?
1,000 on daily basis, the same space. That was given to us almost 70 years ago. When we started in the way, the attendance was just around 100, 150, 200, and progressively we are doing 1,000, the same space. So we've actually abused
the facility
over the years.
But over the period that, for example, you've been at the Public Relations Department, I'm sure that every year you prepare a budget to say that a component of this is going to rehabilitate the hospital. Is it the case that you don't get the money to do it?
We are talking about routine maintenance, and I've told you, if we've not done any routine maintenance at all, you will not be seeing the hospital standing. It will have collapsed. If management has not done intermittent renovation, routine renovation works, this hospital, there will have been catastrophic infrastructure failure by now. What is holding the hospital is the routine maintenance we'll be doing over the years. But given the age and the rate of utilization, if something dramatic had not been done, as being spearheaded by the Santehene, I'm very sure in the next couple of years we will not hear.
We will not even have a hospital.
We will not even have a hospital.
And to the extent that, I mean, you go to the hospital and you are likely, or the possibility of coming back home with another ailment exists.
Exactly. And that is why this project is about renovation and modernization. It's not just about renovating. We're also going to modernize. Now, if you look at Komfo Anokye, it's basically beams and columns. The rest are all windows. But the window design in 1954 was the one that is opened out, the French windows. Now, you cannot put a mosquito net when you have to open the window out because it will tear it definitely. Under the current project, renovation project, we are going to change the window system in a manner that will allow for mosquito nets so that when you come on admission, you'll not be going back with malaria because we couldn't put mosquito nets to prevent you or protect you from mosquito bites.
Right. Let me again, we'll come back to deal with other matters that is attracting our attention this afternoon. These are beyond the project that you are embarking on. I mean, I've seen a lot of text messages. Somebody is asking, we reported about the dialysis center that you had run out of equipment. Somebody is asking that you are holding nurses and mothers because they came to give birth and they were unable to pay their bills, and some of them are being held as prisoners. We'll deal with this matter. Mr. Duwache, so, I mean, what led to this dream to start this project, to raise this amount of money? $10 million, I understand.
$10 million. Minimum $10 million.
What went into the thinking?
A lot has gone into it. Let me first of all say a big thank you to His Majesty for leading this project, and also especially to the current CEO, Professor Dr. Chiradem, who has been also a great vision to the hospital. I think that somebody very prominent visited the hospital, and
He was on admission.
He was on admission, and the first gentleman came to visit. Subsequently, His Majesty also came to visit, and the conversation was had as to what could be done to salvage the current situation of the hospital. I was privileged to have a meeting between myself and His Majesty. In fact, the professor, the CEO, and I went to His Majesty to have a discussion on whatever was going to happen. And trust me, when we got there, when we sat down, His Majesty started telling us what he thinks must be done to the hospital. And maybe I've not said this anywhere. When we came out, the CEO was in tears because we went with a message to discuss what he had come to see at Komfo Anokye Teaching Hospital. But then he ended up telling us, let me put it in this way. Komfo Anokye kura senka ya betimi ayini nanka companies akese ya omo Ghana and commerce as nanka etimi aye nka mining companies ya omo around the same betimi aboa nanka etimi aye MTM for ne ade. This is what we want to tell him. He said, okay, Nana, that's why we came. He says, okay, go and put the proposal together, come back to me, and I'll tell you where you're going to find the money to do it. We're able to do it, and in actual fact, he has taken the bull by the horn, and he's leading this himself. So it is a vision born by His Majesty, a vision born by the CEO that has come to fruition. And the management of Komfo Anokye, I can say, are very happy with this initiative, and they see that, and the board also, and they can see there's a light at the end of the tunnel. Because from where I sit and for what I had seen, I can tell you that if nothing was done, within the next 5 years, Komfo Anokye, for any serious environment, has to be closed down. So this intervention is very timely, and it must be done, and it must be supported by all well-meaning Ghanaians across the
globe. So you are looking forward to raise $10 million US. That's a lot of money.
It isn't.
120 million Ghana cedis?
Yes. And even that, the scope of work has increased. The initial plan was to touch on the inpatient department, the wards. However, upon further consultation, it has become necessary. Somebody asks a simple question. So are you going to do this beautiful thing? I'm sure your production team will be showing the projected end of
the project. If when completed.
When completed. Then are you going to put these old beds in there? So it meant that we had to expand the scope, also bring in equipment, etc. So the entire renovation is taking charge of the inpatient department and then also other ancillary facilities within the hospital. So it's a comprehensive renovation of the entire Komfo Anokye Teaching Hospital that we are looking at $10 million. We have started, we are getting somewhere, and one of the reasons why we are here is to appeal to well-meaning Ghanaians to come on board to support this project, because it is not everything that we leave up to the government to do. Because if we do not sit up, if we do not bring up the, how do I put this? Let's say, something that has to be done by the people themselves and not to be dependent on government all the time.
Because government support is not coming in.
Government support is not forthcoming. As I sit here, if I tell you there's anything in the pipeline for the renovation of Komfo Anokye,
there is none.
There is none. I haven't heard. Maybe coming here, you may be able to tell me as a news.
I mean, and that for me is a concern for money, that we are raising money to rehabilitate a public institution, which originally should be government leading the crusade. Yet private individuals have come together to say that we are raising money. It means that government, some will say that there's total government neglect of the facility.
Elton, let me not put it as total government neglect. We should all be mindful of the fact that resources in this country is scarce, and therefore its utilization would not reach the expected of everybody. So if you do not take an action, it means that we are the end beneficiaries of this facility. In the end, if we do not do this, what's going to happen within the next few years ahead of us? However, remember that people elsewhere, when you travel outside, these things are done by private individuals to ensure that development happens. Not everything should be put at the doorstep of government. The government may have, there are some shortcomings with the government, but it doesn't mean that we shouldn't do anything at all.
So how is it going? How is the fundraising going? I've read media reports, people coming to donate, they go to the Komfo to donate. How much have you raised so far? Are you getting closer to your target? And how is it going?
Let me mention that we are privileged to say that currently we are about 38% of our target, including pledges. We have had one, what's the name? Joshop Construction. He has adopted one block of $1.2 million. Jasmo has also adopted one block of $1.2 million. We've had companies, some of the corporate organization, Oak Plaza has given us 1 million Ghana cedis, MTN 1 million Ghana cedis, and other social clubs have also come on board. It means that with the 38% that we are looking at, if everybody came on board, the King's vision was to say that beyond corporate Ghana, if every household is to give him, let's say, an amount, 100 cedis minimum, every household, 100 cedis minimum, it means that we are good to go. And for us, behind this project, I saw it that if we got 1 million Ghanaians across the world to donate 100 cedis each, it means that 1 million Ghanaians have already contributed $10 million. And it means that we are already there.
And that will be all that you need to undertake this comprehensive renovation of the facility.
For now, I can say that if we got $10 million, it means that we have achieved our aim.
And 38%, I mean, you are at $3.80 million out of 10 million.
Let's put it like that.
And what is ahead of you is quite huge.
It's quite huge, but we are optimistic because we just started the fundraising in November. And if within 3 months we have been able to do this, it tells me that corporate Ghana at the time of the launch may have been closing their books owing to the closing the year. But I'm expecting a lot of them to come on board. We have reached out to quite a number, and some of them that we haven't really reached out to have gotten in touch with us that they will come on board to support this project. Beyond the corporate organizations, we are looking at churches, identifiable groups. We are looking at mosques. We are looking at unions. We are looking at even all students' association. One of the very unique donations we received was from a school, Just Hope preparatory school of children of about 5 years maximum age, donating 500 cedis to this project. It tells you that if everybody came on board in this size, we should be able to do this with ease. This is for us, and it is.
So for those who have donated, is there any benefit they stand to gain from this donation?
Yes, please. Also, there's something called the Walls of Honor. If you are entering Komfo Anokye Teaching Hospital, we are going to have a wall of honor and then beyond the walls of honor also, we also have some appreciation that we are giving to the person that would donate beyond a certain threshold of $1,000, etc. As I speak, on the 11th of March, the Asanteman Association of Europe are getting ready to also launch and bring on board their quota or their contribution to this. Because they sit there and they tell you that we are here, but our family is down there, and they need to get access to proper health care other than what is happening at the moment.
Mr. Bempong, so you are undertaking this rehabilitation whilst people are still on admission at the wards. How are you balancing it?
Yeah, what we have wished was to maybe get a whole block vacated so that we can speed up the work. Mm-hmm. Unfortunately, I've told you about the disparities in healthcare infrastructure in that region. There's no other hospital that can take over the work that we are doing. So relocating or evacuating patients is not an option. So what we are doing now is to do phased execution, where we are emptying some of the wards and allocating their patients to other wards within that same department, so that we create some free spaces for us to start the work. As at now, we've done that of A4 and A5, where we've shifted the patients to A3 and A2. And therefore, we started work seriously on A5 and A4 after we finished the renovation and repairs of the roof. That was the first phase. That was the extent of deterioration, the extent that the whole ABCD block, that's the G blocks, it was leaking like a sieve. And that whenever it rained, 1 week after the rain had stopped, water will still be seeping into the walls. That was how bad it was. Fortunately, because of this project, now we've been able to repair all the roof on the first time in over 20 years. When it rained, the staff and the patient testified that the walls or the roof was no longer leaking.
It is now better.
It has stopped completely. So we've now started with A5, we are going to A4. We've managed to get a space somewhere that we've squeezed to put some beds there. We are going to relocate patients from A3 to that space so that we can get A5, A4, and then A3 available for the renovation works to continue. So we've adopted a phased approach, and that's what is going to extend the period that we allotted for the execution of this project. We thought that we could do it in about 18 months. But given that we don't have any other facility to take over the work that we are doing, or for us to offload our work to them, it's become impossible to get the blocks fully vacant and available for this work. And therefore, we've decided that we do it in phases.
All right. Let me ask another question on the fundraising activity, and then we'll deal with other matters and come back to conclude on the fundraising. And this question goes for the two of you. So I remember when I was with Love FM, I accompanied the Asanteman to the Komfo Anokye Teaching Hospital to inspect ongoing projects. And concern came up, and it's about expanding the facility. And the CEO then, I remember Professor Hene said that, they've been trying to get more land to expand the Komfo Anokye Teaching Hospital, but it appears the hospital has run out of land. The Otumfuo said he was going to intervene with the military to ensure that Komfo Anokye will be able to move to the military quarters that is closer to the hospital. It appears nothing has been done regarding that particular matter.
All right. Behind the scenes, something is being done. Otumfuo caused a committee to be set up. That committee has finished its work. It has submitted its recommendations to the Ministry Police, and it is being studied by Otumfuo. The initial agreement was that they were going to allocate part of the military land to the hospital for its expansion projects. And so it is being hoped that maybe in the next couple of months, Ministry will make a formal public declaration on the matter, and the hospital is likely to get some additional land to help in the execution of pipeline projects. There are a number of projects that are on the drawing board, and we are very, very confident that in the coming months, something good is going to be heard on that.
Sammy, you want to add something to it before I move to other issues?
No, it's okay.
Okay, so we'll come back to conclude this discussion on how best people can donate, or whether cash or in kind. But there's been few running issues regarding Komfo Anokye Teaching Hospital. Last week, for example, we reported shortage of dialysis machine that prompted redirection of patients to private medical facilities. What caused that?
Well, we know Komfo Anokye is one of the few, I think it's the only public facility in the Ashanti region that has a dialysis center. With time, due to lack of investments and other resources, the center began to run down. So the management then decided that they were going to execute a new project that is going to expand, renovate and expand the existing dialysis center. And because of that, the old dialysis center was closed down. So a smaller space with the limited machines that we have was found, and a new service was started at the special ward. Fortunately, the old dialysis center, which is going to take about 13 machines, will be completed by next month. We've signed a number of agreements and made other arrangements for new machines to be brought in. Nivash Medical Supplies is one company that is bringing us 3 new machines at the cost of about 1.6 million Ghana cedis. 3 machines with 3 months of consumable supplies. That's because you could imagine 1.6 million for just 3 machines. It's very expensive. So if you don't get state support, it becomes virtually impossible for you to use.
And are you getting it because they have their own concerns with treating kidney patients? I don't know about the story at Komfo Anokye Teaching Hospital.
So far, that support hasn't reached us. But we are exploring other private sector interventions like PPP. But they are so expensive. The average patient cannot pay.
How much are you charging for a session?
We are around 400 Ghana cedis per session for now. But with the new equipment coming in and the costs, associated costs, I wonder if we can maintain that.
That means the 400 may go up.
It may. I'm not sure we can deliver that service at that level at the same cost. But we live to see.
And that will be a big blow to those who are suffering
we are
kidney complicated issues.
Other partnerships too. Now we are in talks with the Ottawa Hospital in Canada. They are helping us with about 20 refurbished dialysis machines. But they are refurbished ones. And usually we don't like the refurbished ones because there's so much pressure on us that if you bring in the refurbished one, they do not last that much. Springfield, they have also promised us 5 delivered, 2 refurbished ones, 5 refurbished ones delivered 2, and we are waiting for the other 3. So in about a month or 2, we should be in a very good position. But for now, yes, we have issues with dialysis machines.
So the 400 Ghana, is this subsidized or is it full cost recovery?
It is. We are breaking even because they are old machines and their supplies are not as sophisticated as the new machines.
So until government is able to support, the 400 cedis may go up with the new machines that are coming in.
Because we even have proposals for PPP, and as I've told you, if we really want to roll out fully, we now have a center that can take 30 machines. We have another center that can take up to 12. If we want to roll out fully on our own, we can't. We are just making available 1.6 million cedis for just 3 machines. So if we are doing the 13, in addition to the 12, we will need a lot more support than the hospital can now accommodate from its budget. We have PPP proposals on our desk at the moment, but no PPP.
No response yet.
We are yet to take them up because it will result in a price increase.
Yes.
Because if a private person is coming to put his or her machines and then supply the consumables at the current market price, this is the challenge with public health sector in Ghana. The businessman changes the prices as and when the dollar CD exchange rate changes, as and when the port charges change. And so they will not wait because Parliament has passed a law indicating a price for a service. And for 1 year, it is not changed. And so the person will continue to take what has been approved.
I remember when one of the recommendations from Kolebu was that they have already made proposals to the Ministry of Health on new charges and fees, but that has yet to be approved by Parliament. I don't know whether we've also made similar recommendations to the Ministry of Health, especially on dialysis.
Usually, when it is passed,
it affects everybody. All right. So I'm getting a lot of comments on other issues. Now, somebody says that new mothers and patients are sometimes detained at the hospital over unpaid medical bills and postnatal expenses.
See,
I thought health insurance takes care of.
It is not everything. You see, that is what people must know. It is not everything that is covered by health insurance. We are a tertiary facility. There are certain things that you do for you that might not be in the health insurance package, benefit package. It happens all the time. Because depending upon the complexity or the complicated nature of your condition, we may have to resort to other procedures and medications that are not in the health insurance. But the major challenge that we have are people who come there without health insurance. Ordinarily, if you have health insurance and you're unable even to pay the cash one, there's a certain arrangement that we can reach, agreement that we can reach with you for you to go and then pay the rest of a period of time. Because the health insurance component will have taken a chunk of the bill. But the challenge is that most of the people that you see complaining are people who come there without health insurance. Elton, one thing we should know is that we don't get things free. Just as the private hospitals go to the market to buy things, it's the same market that we go to buy things. And we even go through a more stringent procedure through the procurement channel. There is an established procurement system for us that the private sector may not even go in. The private sector can just go to the street and buy this book for 10 cedis. But if we are to go and buy it, it will be about 12 cedis. Why? Because whoever we are buying from, we will make sure that the person is paying VAT. He has other legal obligations that he has complied with, that the private sector person will not be compelled to comply with.
So as we speak, are there mothers on detention?
It is possible. Even yesterday, there's some philanthropists came to pay some of the bills. When you go and credit things to deliver care, you must be able to get the money back so that I can pay your creditors. Or if you are not able to do that, then next time around, you can't even get consumables to provide that care. And that care will be interrupted. I don't think that's why we want as a nation.
But how is that impacting on your finances?
A lot. We have something we call paupers. And if you come and see waivers that we've given to these paupers, you'll be surprised. Because the person is unable to pay, the person is occupying your bed. Meanwhile, we have people who are queuing up to be admitted. So out of frustration, you let that person go so that you can get new admissions. And that's a loss. So we have very serious operational difficulties as a result of these paupers. And therefore, the pressure should not be on the hospitals to relieve such patients. Because you create an epidemic, then anybody who come there and they will tell you, you don't have money to pay. Because there's so much pressure on you. If you allow them to go, I'm telling you, we will create an epidemic of paupers where everybody will come to the hospital and
expect to be treated free of charge. Final issue, congestion at the accident and emergency center, and there are instances where patients on admission are seen lying on the floor.
Yes. First, Komfo Anokye has the highest rate of congestion among the teaching hospitals. It's also because of our unique position as the sole tertiary facility in our enclave. In fact, National Ambulance Service data will tell you that they take more patients to Komfo Anokye than any hospital in Ghana. We've topped consistently. If you come to Greater Accra, combine Kolebu, Rage, University of Ghana Medical Center, and 37. The number of people that are sent to these 4 facilities by National Health Ambulance, they don't even rate that of Komfo Anokye. Komfo Anokye's figure as one hospital is higher than the 4 hospitals combined. That should tell you the kind of pressure that is on us.
Because we are getting cases from all over.
All over. There are spaces that were designed for 12. If you go to Komfo Anokye now, Orange, 12. The minimum you count on any day is 40. That's why when you come and you tell us that we have no beds in normal Komfo Anokye, we tell you that is not true. We have space, lack of space. That's our challenge. How come a space for 12 people, we're able to put 40 beds? It tells you that we've been able to get beds. But we've compromised the space. And at times, because of this thing, you may also end up compromising the quality of care. Because the space that was given to you for 12, you're now taking care of 40, 42, 43, up to 48. We need a lot more support as a teaching hospital. That's why we are here. People think that, okay, why should we help Komfo Anokye?
Because you generate funds internally, and you should be able to be on your own.
That's another misconception. There's no hospital in Ghana, a public hospital, that has been allowed to generate hospital to cover HR, that's salaries, and to cover capital expenditure. There's no hospital. Our tariff structure is said that you have to recoup what you spend on consumables. Per the healthcare financing policy of this country, capital investments, like the one Utunfo is helping us to do, salaries are the responsibility of the state. So what we've been allowed to charge is not meant for these things. And that's how come the government has never tackled us or compelled us to do some of the things that we are asking it to come and do.
Okay. So in wrapping up, the way forward so that we can bring this discussion to a close. Sammy?
Well, Elton, we are here for one thing, and I'd like to say a big thank you to the multimedia family, especially with Ken, for leading this and ensuring that our information is out there to the general public, and in our effort to raise the $10 million target that we have been given to be able to bring the hospital to an appreciable sanity level. Elton, what's happening is that everyone who is watching this program or listening must bear in mind that if nothing is coming from the government, we should be able to imbibe our sense of patriotism and do things for ourselves. I'm always guided by the quote from J.F. Kennedy. Ask not what your country can do for you. Ask what you can do for your country. Elsewhere, these things are done by private individuals. If we do not take this action now, if you come to Komfo Anokye tomorrow, it might not be there for you. It is for us. So we must support His Majesty to be able to ensure that Komfo Anokye Teaching Hospital receives its former glory. How do I donate? For individual, corporate Ghana? What is happening is that we have all payment platforms activated. We are on, we have a short code, which is star 776 star. It will be answer. Star 776 star 1955 hash. That one is for every network. The 1955 is the year of establishment of Komfo Anokye Teaching Hospital. So you must not miss it. The mobile money platform, which is available to everybody, is also 0544 1955 25. The 25 representing His Majesty's silver anniversary celebration. 0544 1955 25. And any Fidelity Bank that you are able to visit, if you ask for the Heal Komfo Anokye project account, both the USD and then the CD, you'll be provided with. However, I'm also privileged to mention that our website is very active, healkomfoanokye.org, www.healkomfoanokye.org. All these also apply to our social media platforms. We are appealing to everyone who is available, all well-meaning Ghanaians. Donate your quota. It may not be for your benefit, but for the benefit of the ordinary person who has no hope of a better health care. If we are able to do this, posterity will judge us favorably. One day, you'll sit back and say that when Otumfuo was celebrating his 25th anniversary, I contributed my 100 Ghana cedis to make Komfo Anokye great again. We are the ones who stand to benefit, nobody else. Leave the politicians out. They have theirs, but this is for us. It is by us, and we will be able to do it. Mr. Samia Dubuache is chairman of the Heal Komfo Anokye project, and of course, coming from Public Relations Officer with the Komfo Anokye Teaching Hospital. Thank you very much for coming through. I wanted to ask you about D5. And why you christen a block D5, and then the assumption is that when they take you to D5, you are not coming back home.
So this project presents us a unique opportunity to change that narrative. We are not going to name the walls after people who are going to fund the renovation of those wards. So Elton, you can come for D5. We will name it Elton John Brobe ward instead of D5. We are going to change all this. D5, when they put you at D5, that means you are almost on your way to join your ancestors. The narrative is changing. It's not even that. You see, it's kind of conditions that are admitted.
Okay.
Besides that, there are a number of people, including my own father and other family members, who have been to the D block and
came back home.
Exactly. So it depends upon what condition you bought and at what time. We know our health-seeking habit is so bad. Whenever we are sick, the first place you go is the drugstore, the malam, the sofo, and before we even come to the hospitals like Komfo Anokye,
it's already late. All right.
So that's a major contributing
factor. Thank you very much. And the target for the Komfo Anokye Hill project is $10 million. As we speak, they've managed to raise $3.8 million, which means that there's still more to go. Donate now, and he's provided the avenues which you can donate to help bring Komfo Anokye to that international standard that we all want it to be.